It is another tale of two cities. Some city neighborhoods that have suffered the highest hospitalization and death rates from COVID-19 also have some of the lowest vaccination rates to protect against the illness. This inequality largely follows racial and economic lines, and in one case, the stark divide spans only a few city blocks. Here's the story from NY1's Rocco Vertuccio.
East Harlem is just blocks away from the Upper East Side, but the neighborhoods are worlds apart when it comes to getting vaccinated for COVID-19.
I'm looking forward to starting this journey of making sure that I take care of myself and the people around me.
Marcus Sanchez of East Harlem got his first dose of the Moderna vaccine on Tuesday after trying for several weeks. He is one of the lucky ones here. City records show that about 13% of adults in East Harlem, which is largely black and Latino, have been fully vaccinated against COVID-19. That's about half the percentage fully vaccinated on the Upper East Side, which is largely white and more affluent. This, even though East Harlem has far higher rates of hospitalizations and death from the virus. Similar racial and income divides exist citywide.
I mean, it's extremely frustrating because we know that individuals of color and low-income communities of color were adversely impacted by the health impacts and the economic impacts of COVID.
David Nocenti runs Union Settlement, a social services provider in East Harlem. He says the racial disparity is partly the result of a lack of internet access and greater mistrust of the vaccine in communities of color, factors the city is trying to change. Union Settlement is attacking the divide by using its senior centers as vaccination hubs, but a lack of supply is hindering the effort.
It's really asking a lot of someone to get on the subway, go down to the Javits Center to get vaccinated, to come back. So we've been really pushing hard to have as many vaccines here in East Harlem for the local community.
The Barica Neighborhood Health Center here only has enough doses to vaccinate its clients. That will soon change. As part of the new federal COVID relief plan, the center and other local hubs will receive a supply of doses earmarked for communities most in need.
Our understanding is that once HRSA starts to provide the vaccine, that we'll have not unlimited, but almost unlimited supply as we need it. So that will be very helpful.
Marcus Sanchez can't do much about the supply, but now that he's getting vaccinated, he can spread the word to neighbors reluctant to get their shots.
If they're able to get it now, get it now. Because it'll save, once again, not only your life, but lives of other people surrounding you.
In Manhattan, Rocco Vertuccio, NY1.